Come in.
Hello, Mr. Smith. Hi, it's Nurse Williams. How are you today?
I'm fine.
So I got your view for a patient.
Okay.
Yeah. This is Khadijah. She's a new nurse. She's going to give you your insulin shot today, okay?
All right.
Today, your blood sugar was 160, so that's 2 units of insulin, okay?
All right.
All right. We gave it in your right upper arm yesterday. Do you want it in your left arm today?
That'll be fine.
Okay, sure. Well, Khadijah, you can go ahead and wash your hands and put your gloves on, and then you can give Mr. Smith his shot. So how is your day going?
Great.
I hear you may be going home later this evening.
Oh, that's nice.
That is very awesome. Okay, so I'm let Khadijah go ahead and give you your injection. Your shot.
Ow!
Oh dear.
The nurse stabbed me.
Oh no. Are you okay? Oh, Khadijah, can we have some guys? Oh, okay. It's just a little blood. You're okay. I'm just gonna put a little pressure on it. All right, so Khadijah, what happened with Mr. Smith? Did you tell him what you were going to do before you did it? Did you clean the site with alcohol? Okay, so let me just educate you on giving a subcutaneous injection. Okay, the reason that we give subcutaneous injection is because we give medicine and we want it to go into the subcutaneous tissue. Okay, so like I explained to Mr. Smith earlier, you can give it in the sides or the back of the upper arms, the abdomen, 2 inches away from the umbilicus, the upper thighs, or the upper buttocks, okay? The medication that you usually give is some type of anticoagulant, a blood thinner, or insulin, okay? So the first thing that you do is come in and introduce yourself to the patient and let them know exactly what you're going to do. You gather your supplies. You usually have a syringe. You will have the medication. We already have our medication drawn up. You'll have an alcohol pad, and you'll have a 2x2 gauze. So the first thing you want to do is wash your hands and put on gloves. You find the site that you would want to give the injection, and we can even practice on me. Okay, so Khadijah, you'll find the fatty part of my arm. You want to clean it with alcohol in a circular motion for 3 to 5 seconds. Okay, very good. And you want to pinch the skin because you want to make sure the medication is going into the subcutaneous tissue. You want to insert the needle at a 45-degree angle and push the medication in very slowly. Very good. Once you remove the needle, you want to just hold a little pressure with your 2x2 gauze. And you want to put your needle into the sharps container immediately because we do not recap needles. Okay. Some of the special considerations when giving a subcutaneous injection, some patients are very frail. They don't have a lot of fatty tissue. So you have to make sure that you find an area that you can actually give the medication and be sure to pinch the skin to make sure the medication goes in exactly where you want it to go. Another thing, a lot of people are really afraid of needles, so you always want to explain what you're doing to the patient and be as gentle as possible. You also want to change the site that you're giving your medication in because one of the common mistakes is that people tend to give it into the same site. That can cause bruising, pain for the patient, swelling, and just irritation. Some of the common mistakes that people do is they push the medication too fast. Like Levinox, for instance. You usually give that into the abdomen. And if you push that really fast, I've been told that it feels like a burning sensation shoots all throughout the body. So you always want to make sure you push the medication very slowly. You always want to make sure you change sites. And then sometimes people massage the site right after giving the injection. You don't want to do that because that can cause bruising and irritation later. Some of the complications are infection, bruising, lumps, and pain. Okay, so now that you have been educated on how to give a subcutaneous injection, are you ready to try it again? Yes. Okay. Hi, Mr. Smith. Listen, I want to apologize on behalf of me and Khadijah for what happened earlier. She is a new nurse, and it's my fault. I should have been watching her more closely. We don't want you leaving with a bad experience. So if you will give us another chance, I have educated Khadijah on how to give a subcutaneous injection, and I feel that she really has learned and really knows how to do it proficiently. Okay? All right, Khadijah, so you can go ahead and wash your hands and put on gloves, and I'll just get out of the way. All right, so she's going to give you your 2 units of insulin. We gave it to you on your left arm earlier this morning, so this evening we're going to give it to you in your right arm. All right, we're going to lift your shirt, clean the site in a circular motion for 3 to 5 seconds, pinch the skin to make sure the medication goes exactly where we want it to. We want to inject our needle slowly into a 45-degree angle and push our medication in slowly. We want to remove our needle and cover the site with gauze. And we're going to put our needle in a sharps container. Very good, Khadijah. I'm so proud of you. Excellent. Mr. Smith, thank you so much for all your patience.